same.
All right. Well, thank you all for helping me with this. Okay, I think we're good, hopefully. Sorry to interrupt. You were all fantastic.
Okay. Just don't.
Now, Jonathan, now what? How do I get out of this?
Oh, just minimize your window, or minimize your internet, and then just go straight back to Zoom now. Or you can hit Alt Tab on your computer, and it should bring you back.
Fantastic. Thank you.
Yay. Yeah,
all right.
So thank you. Yeah, so again, the point of this is just looking at some different demographics, and I think we see this borne out in all types of violent victimization, that underserved communities tend to experience the brunt of this violence.
Alexis?
Hi, everyone. So just a little conversation about reporting during COVID. Community partners right now, at least in the Denver metro area, are experiencing fewer hotline calls, whether that's to sex assault hotlines, domestic violence hotlines, but then call numbers are going down. Law enforcement is reporting fewer reports of domestic violence, both in probably the categories that are encompassed by Callie's work, and also under just Colorado statute where it's an intimate partner. And generally speaking, right now, there's fewer opportunities for bystander to intervene. We're not out and about with other people right now. We're not at school functions. We're not at restaurants together. We're not, catching Ubers late at night on the street. And all of these things mean that there's just fewer opportunity for an outside force to help intervene, and also for someone experiencing abuse in a closed setting, in a home that's in some ways feeling a little probably inescapable, that they're not in a safe place to even make a phone call. So that if you all don't know, that most of the websites like CCASA, which we'll talk about more later, which is our sex assault nonprofit here in Colorado, and Violence Free of Colorado, and lots of the local nonprofits that do direct service, they have escape buttons on their websites. So if someone were to be on the site, they could easily click out of it without maybe someone behind them knowing what site they were visiting. But in all likelihood, that's not providing enough protection right now for people to feel safe enough to report in the same numbers that they were before COVID really took hold of our day-to-day life.
Thank you, Alexis. Thank you, Callie. Callie, I think you can address this.
Yeah, so I mean, I don't think it's probably a surprise to most people that domestic violence is a big problem in the nation in ordinary circumstances. But with COVID and the stay-at-home orders, there are a lot of additional stressors that have impacted all of us. One of them being, and this is in no particular order, is it a complete list, but financial stressors. A lot of people are looking at the possibility, or they've already been laid off. Furloughs, lost income, lost insurance. These are major issues that lead to stress and can make domestic violence issues great. We've got people who now are at home, maybe on a greater basis, living with others with mental health issues, or they're dealing with their own. So this becomes problematic. Limited opportunities to leave to seek help to make change. I think people feel more trapped than ever. And then the additional responsibilities, child care, parent care, spousal care that a lot of people are taking on top of their work care and other things like that. The homeschooling, we see a lot of that online, talking about the stress related to that, working from home, the challenges with that. And what I personally deal with is that so many people seem to think now that we're at home, we have a lot of free time, and a lot more work is being piled on us. And I don't know about other people, but I haven't found more free time being at home. COVID presented a lot more challenges as a professor of dealing with students and their emotional needs on top of their academic needs. There is the additional stressor of fear of illness of oneself or others, or distance from family members who may be ill past. My own self, my father has terminal cancer, and I look at COVID as realizing I probably will never see him again. And when people do pass, we can't be there for funerals or other deals like that. And that's really challenging and very stressful. And I think Alexis wanted to address a few more of the stressors that are more specifically domestic violence related in the next slide.
Thank you. Thank you, Callie. Oh. We
Got it. Just figured it out.
we are all figuring this out together.
These there are larger stressors going on just in the system that often offers some safety to survivors right now. Locally, we are experiencing a couple of these things directly, which is that if someone were on a jail sentence, assuming they're in the county jail for a lower level domestic violence offense, or even potentially a non-related offense that has given a survivor some space from an abuser, they are likely to be releasing lower level folks earlier and faster in COVID in order to keep the incarcerated population safe. And this is an understandable step in many ways, but it could mean a greater feeling of risk for survivors who may have already taken some big steps to separate themselves from someone who perpetrated abuse upon them. Right now, there are no, there's a stay on jail to prison transfers, and for a survivor who has reported and gone through the criminal justice system, if the person who offended against them was sentenced to prison, they may still actually be in a holding pattern in the local jail because the Department of Corrections is not taking new folks right now. That can be unnerving, I think, for a survivor, and just the unknown, I think, increases. But it is a system stressor for our local sheriffs to try to deal with what to do with folks who are incarcerated right now. And then prison releases are happening in a different rate than they did before COVID. Again, there, I think, is some rubrics to make sure that those who have committed violent offenses are not going to be part of that increased releases. But again, if the survivor has space from an abuser, even if the offense wasn't domestic violence, that person coming back into the community could present risk to the survivor. And again, that fear of the unknown, because we'll have a lot of unknowns that we're trying to deal with right now. So those are just some things that you all should be aware of other things going on as far as the system having some extra burden with trying to keep prison populations and jail populations safe.
If I could just add real quickly to that, Alexis, I think one of the other things that comes to mind to me is the delay in cases. So I think a lot of folks are going to come into the system, and if the offender isn't resolving the case until June or July or August because of the delay in the system right now, that means that domestic violence treatment and other attended sentencing aspects probably won't come into play for a while, which I think could start to impact cases. And then I think what you hit on earlier, the lack of interveners, I think goes beyond reporting too. I think that's an important reporting problem. But then I think what happens is often a judge might modify a protection order, for instance, to allow folks to have contact just in public, which is obviously no longer an option, as you were pointing out. And so I think that could also be problematic too. So there's certainly a lot of challenges to be looking after.
Yeah. And to tag on as well, that's a great point, Gordon. We're also, a lot of counties have made great steps forward in doing evidence-based bond, but there are still different bonding standards that are happening right now. And so someone who may have been previously held in a jail on a cash bond may be eligible to be released into the community on like an ankle monitor. And that can be something that's difficult to explain and for survivors to absorb when they've made that bold step of reporting. We'll go to the next slide and just talk about the Victim Rights Act a little bit. All of these things that are happening, whether it's reporting through sentencing in the criminal justice system, it's good for everyone to know that we do have a Victim Rights Act here in Colorado. It is the right for every survivor to be treated with fairness, dignity, and respect by law enforcement, by judicial officers, by the district attorneys involved in the cases. There are rights that attach to the officers who investigate. There are rights that attach when the case moves over to the district attorney's office. There are rights that attach when a case might move to probation, and there's rights attached in the paroling of someone from prison. There are a lot more. Those are but you can see it goes from the beginning to the end of a case. And it means that a survivor has the right to be consulted at all critical stages. One thing that I think one of the questions Callie pointed out was, when do victims get to be informed? And the bottom line is that they should be not only informed, but have the right to be heard, particularly on court issues like bond. What we're experiencing, I can say from Rocky Mountain Victim Law Center, is many of the courts are on different web-based video programs. Many of them have their own systems with victim notification. Some of them have transitioned quickly to doing more things by phone and video conferencing. Some of them have transitioned more slowly. And so there's really spotty coverage about who is handling and how successfully folks are handling this, the victim issues that are coming up with us trying to be mindful of the other health risks that COVID pose. Gordon might want to speak to some of the things that they're doing in Larimer, but across Colorado, we're just seeing a lack of victims not only being informed of court hearings coming up or changes in bond or changes in sentencing, but we're also seeing an inability for victims to access the court process and to be heard by the judges who are making these important decisions.
Yeah, I think it's really difficult. Here in Larimer County, as I know, in most counties, we have a victim advocate department that works with folks, and they are still working and are working from home mainly and still contacting people. But it is tricky because of some of the issues Alexis mentioned. And like I said, a lot of the cases are delayed. Different judges are hearing cases. Cases are being set on different days. And sometimes courts are doing that without notifying the DA's office, for instance. And so it's hard to keep up with the changing dates and schedules and all the directives we're getting from different health departments and so forth. So it's a process that I think everyone's struggling with, but we're certainly doing our best. And nothing I think Alexis would agree with that about COVID-19 relieves us of those rights, and we take those things just as seriously. So we're definitely working really hard to make sure those things happen, but it's a difficult time for it.
Thank you.
Right. And before I talk about this, I also wanted to say that, one of the things that I'm seeing online, or actually, I hate to say it, but some people joking about, I work at a university. I was our Title IX coordinator and the director of our Office of Equity at the Anschutz downtown campus for a couple of years. And so there's this notion now that the universities are shut down, that this isn't a problem among college students, and nothing could be further from the truth. So they are at home, and so there are, at risk of things that can happen at home. But what we're finding in the Office of Equity still is that the number of our calls have increased. They've increased because people feel the distance from campus makes them maybe a little bit safer to make those calls that they didn't feel before. So it's been very interesting to see the way COVID has magnified the problems that have existed all along. And that's even the case where people on places that have been abandoned for the most part. So on this slide, I just wanted to talk about some positive actions we can all take, because there's nothing about COVID that's made life easier for people. And so these are just 7 ideas. Just being kind to yourself and to other people. everybody's having a hard time right now, but also that everybody is different, and don't expect that you have to feel a certain way or wonder why you're not feeling a certain way. We're all going to deal with this in our own ways, and there's no wrong way to do it. To take breaks from news stories and social media, if you sit on Facebook all day or Twitter all day, then you get nothing but the doom and gloom. And I have to watch myself on this as a news junkie. It's not healthy to do that. And so maybe telling yourself that you can look at news once a day and then you're done with it is a healthy thing to do. To care about yourself, to eat healthy, to try to exercise, to try to meditate, to get some good sleep, to be sure to put yourself first and have self-care. Avoiding alcohol and drugs is not a great time to overindulge in these things. Some would argue it's never a time to indulge in these things, but this is definitely not the time to overdo this. And making time to unwind and do what gives you pleasure. Spending some time alone. For people who are in households maybe with children or extended families, they may not feel like they ever have time alone. And so you have to carve that out and you have to make that your time. But also connecting with other people. I myself have set up multiple get-togethers through the week where I Zoom with different groups of friends, or I'm checking people that I care about to make sure that they're doing okay. And I think these are really critical, positive actions we can all take. You know, maybe they all don't work for each of us, but if we can do one thing toward taking care of ourselves, I think that that's a good step. Okay.
Thank you, Callie.
And one question, and I'm sure Gordon and Alexis have things to add about this, but we are often faced with somebody who comes to us and says, my sister, my cousin, my friend, my mother is being victimized in a domestic violence relationship. And so what do I do? And so these are just 7 ideas of things to think about. Number 1 is believe the person. When somebody discloses that they're being abused in some way, it is not your job to question them. It is not your job to ask, are you sure? It is your job to believe them and to support them. It's your job to validate the worth, dignity, and potential of that victim survivor. Because a lot of domestic violence abusers, that's one of the things that they take away from them. It is very important not to take agency from the victim or survivor. You honor their wishes and their needs. This is not the time to think that you're the knight in shining armor and you're going to come over and make things right, or you're going to call the police against their wishes. That's absolutely the wrong thing to do. You honor the victim and survivor's agency. Don't think that you alone can save the victim. You can, however, provide them with tools to save themselves. I think we all have to learn to be patient with victims and survivors. Learning to leave takes practice and happens when the victim is ready. And you have to be really careful. Statistics are very clear that when a domestic violence victim survivor leaves that relationship, it is the most dangerous time. And this is where a lot of these individuals become homicide victims. So you have to let them do it when they're ready. It's important for each of us to be a constant and stable presence in the victim and survivor's life, and to be clear that the victim survivor knows that the abuser alone is responsible for their violent behavior. It is not on them. So I don't know, Gordon and Alexa, if you have anything that you want to add to that list.
Yeah, I think that's a great list. I agree with that. You know, in the criminal justice system, I think we do need to do a better job of believing victims. And that doesn't mean that there isn't a second step, which is evaluating the evidence. But it's important to know that that starts with supporting victims.
Yeah.
Just to add, I think Callie might be more aware of the whatever new literature is out there, but generally someone might leave 7 times before actually making a complete break from an abuser. And so, you know, if you're the neighbor who's giving support on the 2nd or 3rd time, put any paternalism and maternalism aside and let the survivor's voice lead the way, and be there even when it doesn't work out the way you think it could or should. I think that's wonderful advice, Callie. Thank you for bringing that up.
I think that's such a great point too, because we hear a lot of people complaining about, well, if it was that bad, they would leave. And that's not the fact of how these things work. If you think back to your own relationships in the past and when you were in a relationship that wasn't the best, but maybe didn't involve domestic violence, And how hard was it to separate out of that relationship? How hard was it to figure out how you're going to move your things? How are you going to afford that? Now add on top of it that your life is jeopardized. It's not easy to do these things. And for these individuals, it's incredibly hard, and it does take many, many times. And so we have to be patient with them and let them do it at their own pace. So yeah, thank you, Alexis. That's great.
Jonathan, we have Representative Jonathan Singer with us tonight.
Yeah. Hi, John.
And I wanted Jonathan to talk about one of his domestic violence bills that he introduced. Jonathan, could you tell us a little bit about that?
Yeah, no, well, first of all, what a great lineup of folks on a Friday night. I want to tell you, I'm paying for everyone's parking tonight. So that's on me. And, you know, hopefully, you know, I'll never have to see you in court as a district attorney. So, you know, a lot of the stress that, you know, that adds to this is, you know, what control do we have over these situations, not just in our, if we're experiencing imminent partner violence, but also what is going on that we can stop this for other people and work in coalition with them. So Violence Free Colorado has come to the table with a bill that looks at the intersection of gun violence and domestic violence. And I apologize for not having my own slick PowerPoint for this, but I did want to just share a couple of statistics with you and then talk about this bill. It's House Bill 1278. And what this is making sure that we have better procedures for a domestic abuser when a protection order has been, issued. And this is the problem we're trying to deal with right now. We know, and you've already heard, that the likelihood of something turning violent and or fatal is greater after somebody leaves their home. Well, domestic violence is something about power and control. So imagine now you've left the home, and then on top of leaving the home, you've actually gone to a court and gotten a protection order issued against your violent partner. Now that person has not only lost control over you not living in that household, but now they are subject to the court system. So this is something that I think is really important for people to understand, that the violence level and the likelihood of violence increases even greater. And so there was a study out of Johns Hopkins School of Nursing that said the best indicator of whether a woman will be killed by her partner is prior domestic violence between those two people. 70% of the women who were killed by their partners had been abused by that same person before their deaths. And if the victims were previously threatened with a gun by their partner, the risk of death jumps even more dramatically, leaving the abused 20 times more likely to die. So every year, 600 women are shot to death by their intimate partners, and Black women are twice as likely as white women to be fatally shot by an intimate partner. So we have a Colorado Domestic Violence Fatality Review Board. In 2018, that review board showed that 67% of domestic violence deaths were firearm related in the previous year. And in 2018, it was 3%. And this death toll doesn't just go towards domestic violence, but also to mass shootings. 54% of mass shootings, more than half of mass shootings where 4 or more people were killed, the shooter had killed an intimate partner. And just to bring that a little bit home, a little bit more, states that require that domestic abusers provide proof that they've relinquished their firearms, there's a 16% reduction in intimate partner gun homicides. So the bill that we have addresses this issue by saying, let's look at the laws on the books. The law on the books says if you have a protection order issued against you, you need to relinquish your firearms. But it's up to the court system, it's up to our judges to enforce this law. What we're doing is creating a standardized, fast-track process for every court system to make sure that defendants report and relinquish their firearms. And then we put the onus on our county sheriffs to store those firearms, hold on to them, and make sure that they are only transferred back once the protection order has been has expired. So assuming there's no other crimes. So you know, we try not to talk about this in terms. I try not to talk about this in terms of gun safety, or because I don't want to. The Second Amendment advocates out there will use this as an excuse. But what I do talk about when I do talk to our Second Amendment advocates is I say, don't you believe that we should enforce the laws that are on the books? Our state law currently mimics federal law. And do you or do you not believe that domestic violence offenders should have guns? And if you don't believe they should have guns, we should have this bill that creates this easy, simple, or simplified fast track process to be able to make sure that everybody can relinquish their firearms when they've protection order issued against them. And you know, there are so many personal stories that I could share about this that I'm not going to on a Friday night. But this has made the news more than once in the last year, where we knew someone had a protection order against them. They didn't relinquish their firearms. A judge never asked. And now we have 1 or 2 or 3 or 4 funerals. So these are ticking time bombs that we can help diffuse. It works. And what I'm going to ask for is your help in making sure that when we come back into this legislative session, that I know that we're focused on the COVID-19 crisis. I know that we are going to see $3 billion in cuts to our state services. But at the same time, we need to take a look at the human cost of doing nothing on this issue. And if we can save lives because we're dealing with COVID-19, we can certainly save lives in the face of domestic violence. So thank you all for being here. Thank you for letting me share with you some of those statistics. I'm happy to stick around and I'm look through the comments section and answer your questions, but make your voice heard. Make sure that this bill doesn't get thrown by the wayside because people think it's too controversial at this point in time.
Representative Singer, have you, I assume you are, but just wanted to connect this dot. You've been in contact with Beth McCann about the relinquishment program she's running. Good. I'm so glad to hear that. I think it has a lot of potential to be mimicked in other counties. And I'm happy to give a quick rundown unless you want to talk about the success that Denver's having.
I'm going to let you do it because my battery's at 11% and I'm going to go look for a power cord.
So Denver has had some success with assigning an investigator through their family violence center, a Rosandum Center. And what that happens is the file, when charges are filed, the file is read obviously by a district attorney for charges, but it's also read for possession of firearms by an investigator. The investigator isn't concerned with the actual firearm that may have been used in the commission of the crime. It's whether or not there were more guns described in the house that aren't accounted for. The police on scene, if a firearm was used, is only going to be allowed to keep the one that was used in the incident. They're taking it for evidence purposes. But that firearms investigator, if they learn through witness statements and through follow-up with the family that there are more firearms in the house, then the district attorney's office makes a motion at the bond hearing to ensure further relinquishment of all of the other firearms that the offender might have access to. And often works with the defendant and his family to make sure all those guns are safely stored, so that even if the person is released on bond, they will not have access to firearms. It's not designed to be punitive. It's not designed to create additional charges. It is simply designed to minimize that statistical risk that a domestic abuser is going to get their hands on a firearm and kill their partner. And so it's had success, and it's exciting to see it memorialized now in a potential bill for other counties to take the lead on and to decrease that risk of gun violence in the home.
Yeah.
Thank you.
Yeah, it's an incredibly important issue. So thank you to Jonathan and Alexis for pointing out some of what we can do about it. I think, frankly, most people would be shocked how little is done when information about guns in the home is had I think the assumption out there is, well, of course, everyone's doing all they can. But frankly, that's just not the case. Most counties are not doing what Alexis described Denver is doing. And I think they need to be, including us here in Larimer County.
And well,
Right. And one of the things I wanted to add too, just for kind of general knowledge, is that when we talk about non-fatal victimization, domestic violence or otherwise, the group we see most experiencing this at the highest rates are, say, your 16 to 24-year-olds. Domestic violence is different. And what we find is that the non-fatal violence can continue throughout, as I noted earlier, 20 to, I forgot the age, 45 or 49. But what we know from national numbers is intimate partner homicide. The highest rate is found at about 45 to 54-year-olds. So don't look at somebody and think, oh, they're too old to be dealing with this. This is not the case at all. These people are in great risk as well. And so getting firearms, which are effective killing machines in these situations, out of the hands of people who use them is really critical. But it's also that they'll use it against other people, family members, and then even the offender themselves. So it's a great bill. So this slide was just trying to pull together a few resources, and this is hardly comprehensive. There are a lot of nonprofits and other groups in our area that are out there to help. So these are just some of them. And I won't name them all, but tried to put on this slide some things for just general victim assistance, rape and sexual assault, domestic violence, not being afraid to call your physician if you're struggling during this time, addiction and alcohol hotlines, elder abuse, elder care hotlines. Are you just lonely? And then also a great thing to do if people are struggling is to reach out to help other people and to volunteer. And there is actually a volunteer match webpage out there where you can search databases by location to see where you can be of help to people. So these are just a few of them. And I think Haley had asked if these would be available to people at the end of this. And I think Sally,
yes.
say that you're gonna, people ask that you can email it to them or something of that sort that
Yes.
is available.
I also wanted to highlight too that Safe to Tell app is also available even though students are not in school. They still have access to Safe to Tell apps on their iPads. And if they are experiencing situations, they can anonymously click on that app still and gain support. I just don't know if a lot of people are aware that that app is still in effect, even though there's school closures. Because I know a lot of teachers are worried about not being, being helpless when they would normally be there for those vulnerable children. So I just wanted to make sure that that our audience is also aware of the Safe to Tell app, and it's still in effect, even though there's school closures.
And that's a really great point. And for college aged or people who are in universities or colleges, your offices of equity or office of institutional equity or whatever they may call, those people are still working and they're still taking calls and they can still provide resources and help and care. So don't be afraid to reach out to them as well. And you should be able to get on your university webpage and find that very easily.
I'd like to address some of these questions, if that's okay. So this one is addressed to Alexis and Gordon. Are victims and/or survivors being informed as they should be when offenders are being released due to COVID? Or is the volume preventing this?
They are being informed, and as Alexis talked about, I mean, they're required to be informed. So that's really important that they're being informed. So they absolutely should be. I saw part of that other question about what types of numbers of folks have been released on domestic violence crimes due to COVID-19. That I wish I could answer. I can't. Our office has not released any stats on that, and I don't believe the sheriff has either here in Larimer County, at least. Which is too bad, because that would be good to know for the community and for victims. But yes, victims should still absolutely be notified. If someone thinks they're not, or someone that thinks they have not been, please reach out to the DA's office, because perhaps it's a bad contact or something like that, but we'd love to get a hold of you.
Thank you.
I think statewide, we're seeing a wash of the Victims' Bill of Rights kind of being ignored. And what a meaningful outreach is not a voicemail on a Sunday when someone is going to get released on a Monday morning. And so I think that counties are struggling to comply with the Victim Rights Act right now throughout the state. I think that it's important to know that generally district attorneys' offices are not very transparent about these types of numbers, and that my hope is with more folks interested in community accountability holding these seats, that there will be more transparency and regular numbers provided. In general, district attorneys across Colorado are terrible data collectors, and that's a problem. And this is kind of bringing some of that home to roost when we really talk about what's going on in our county and what we should, as community members, know.
I think it's also important too, if you have those statistics, that it'll help reinforce something like a bill that Representative Singer is trying to pass.
Absolutely.
Yep.
And numbers always help. And
Yeah.
I think district attorneys as a whole are not number collectors. And I think it's often to their benefit that they don't know the answers to some of these questions.
Oh, interesting.
And that's a shame. That's not obviously how it should be.
I think Alexis is spot on.
Thank you. Okay, our next question is, I would like to know, find out county by county percentages of domestic violence releases due to COVID. I guess we don't have those, do we? Do you have those? I mean, we just talked about how you don't have those.
Yeah, that's what I was just trying to answer. In Larimer, certainly that's not something that's been released. As Alexis said, I think it's a much broader problem than domestic violence, but it obviously rings true here.
And
Thank you.
I want to make a plug for something right here too, because a lot of this sort of information, I mean, all of our agencies are starved for money, right? And so we have to put it where it's needed most. And a lot of times data collection is the thing that we lose. But at a lot of our universities, we have the requirement of our undergraduate and graduate students to do internships. And I can tell you that as a criminologist, victimologist, most of our students come into our undergraduate and graduate programs very interested in things dealing with victims of violence. So if you in Larimer or in Jeffco or anywhere ever looking for free work, interns to do that sort of stuff, reach out to a local university, whether it's the University of Colorado, Denver, the Boulder campus, CSU, and we can probably help develop a pipeline if that's something of use. I don't know that a lot of agencies are aware of that. We're always looking for great places to put our students. So
that's fantastic.
Yeah.
Thank you. Our next question is, does the bill allow, oh, this is for Representative Singer. Does the bill allow for searches of homes of offenders for guns?
So, I mean, actually, the short answer is no, but the longer answer could probably be answered by our district attorney folks here, actually. So, so what the bill requires is that that if the partner has a reasonable belief or has evidence that their partner has a firearm, or likely more than one firearm, they're able to report that to the courts. And so the first step really is for the defendant to basically relinquish their firearms. So we're not talking about no-knock warrants. We're not talking about you know, a partner just alleges that this individual has firearms, and they're pursuant to that is some sort of search of somebody's home. But the first step here is putting the onus to say, do you have firearms, or we're told you have firearms, you need to relinquish them, here's how you do it. And by the way, if you tell us, we're actually not going to use that in a court to actually further your prosecution. And so this is actually passes on immunity. So now if there's a search of someone's home, that means that immunity is probably no longer on the table. So the short answer is not immediately. The longer
this is JB Robert Esperanza. Can you take a question?
Go ahead, sorry.
Yeah, that's all right. So the long short of it is not initially, but if there is sufficient evidence, then a warrant can be executed just like a warrant can be executed any other time. But they have a right to defend themselves in a court of law to say whether or not they have a gun. So so this is all done very transparently.
Thank you. One of our audience members has a question. Go ahead.
Hello.
Hi, welcome.
This is JB Robert Espinosa. Can you tell me what the numbers of complaints that you had received prior to COVID-19? What is your cutoff date? When did COVID-19 start? And what numbers of complaints have you had since COVID-19? And well, I really have a lot of questions. Why aren't things like marriage counseling or anger management working?
Okay, let's address those two things one at a time. I'm going to meet you again. Thank you. Okay, who would like to answer that one? The first question, maybe Jonathan, maybe Representative Singer.
Actually, I was going to try and answer the second question.
Okay.
I'm not sure what the question is about the numbers. Actually, is a question about numbers of domestic violence incidents, or what it is, or when that start of when are we going to start measuring this? I would say the month that we're probably going to start looking at this is probably right around the time the stay-at-home order took place, because that makes the most sort of universal sense and is a good waypoint. Usually data does tend to lag about a month behind at the fastest. So there's quite a bit of time. The one data point that I will share with you, and this is, I think, incredibly important for folks to be aware of, but our county sheriffs are actually required to report every year how many times they have issued a concealed carry permit, and also how many times they have either revoked or denied a concealed carry permit. And they're also required, speaking of data, to be able to show how many, the reason why. And one of those reasons is actually the existence of a restraining order, not quite the same as a protection order, but pretty close. And so if you look at those data, and I'm actually just pulling it up right now, it's pretty interesting, because there are dozens upon dozens, county by county, of concealed carry permits that are denied every single year. And the question I always ask our county sheriffs is, well, so you must have a reasonable suspicion then that these people own a firearm if they're applying for a concealed carry permit, or that you've revoked one. So just in 2017, we had 57 denials and 64 revocations statewide, solely on the basis of a restraining order. There are other things based on arrest records, things that are discretionary, mental illness, you name it. Our bill really doesn't deal with those things, but I think it's important to understand what these application denials and revocations look like, because I think this really helps draw the picture of how many people we know who have firearms who haven't had those firearms relinquished or taken away. Because every year when I write the county sheriffs about this, I haven't gotten an email back. The last time I heard from them, they said, well, we don't really have the means to store these firearms, so, we're not sure how to do this. But I don't know if anyone else has any other data they want to share.
I don't know if we answered Jamie's questions, but I would say that from the nonprofit world and victim services side of things, we really kind of started to think about this change in situation for people end of March and into April. So to my mind, though my family's been at home longer than that, and I imagine there are other families who have as well, I think that's kind of the time period we're starting to think about as its impact on our community as far as COVID goes. I think part of the question was why marriage counseling and other things aren't working. That is not my wheelhouse. There are wonderful service providers in the community that work with offenders and survivors and people as couples. But you know, from the criminal justice side of things, if things work, we don't always see the positive result. And so I don't think I can speak to that directly, but I do know there are good providers in the community that work hard to stabilize folks to make sure that they're moving forward.
And just to add on, I'm also probably not the exact right person to answer the question, but you know, in the criminal justice system, at least, it's not usually a counseling issue, or folks aren't sentenced to counseling. What they're sentenced to is the offender is sentenced to domestic violence treatment. And so we are treating the offender in the criminal justice system, supporting the victim. But it's the offender in terms of, again, that definition I sort of talked about at the beginning, which is, you know, coercion and control and intimidation. Those are the issues that the criminal justice system is usually dealing with more so than a counseling aspect.
Right. And I think it goes back to that one point on the earlier slide as well, is that there is only one person responsible for the violent behavior that's being engaged in, and that is the offender who's doing it. So it's not necessarily something the couple has to work out. It's something the offender has to change about themselves. So, yeah.
Yeah. Hi, my name is Fleet Mark.
You do not have the data. You do not know how many people have complained about domestic violence prior to COVID-19, and you don't know how many people have complained after COVID-19. What's the data?
Sure. I think there's some lag time. I can just tell you that anecdotally, all of the hotlines, I don't know if you were on with us at the beginning, hotlines, statewide hotlines for domestic violence and sex assault calls are down right now. And so I don't have access to their individual hotline information, but it's understood right now that the calls are down. And Denver published, the Denver Post had an article this morning also saying that generally calls across the board were down, but level of violence had gone up. And so that's the best frame of reference I have for today. But I imagine these nonprofits at the end of the year will come out with reports that will be able to show a graph and a dip here because they do monitor their numbers regularly in order to make sure that their service continues, and usually for funding as well. So I imagine those numbers will be really apparent come the end of the year.
Right, and at a national level, we're looking at quite the lag. For example, right now, the most current data that we have at the national level is for 2018, because we're talking about hundreds and hundreds of thousands of cases that have to be dealt with. So we can't expect to talk about it at a national level until at least a year from now. And then we'll have some numbers to go by.
Well, I don't understand why you're even talking about this now. You don't have the data. You don't know what's happening.
JB, I can give you some data here. So first of all, you know, the baseline has already been presented because we have that. One of the challenges is there's no single statewide or even national one hotline. There are many hotlines to be calling. So I'm going to give you a statewide perspective on this. And this is a little different, but I think it's important and it helps describe what's going on. So we have a statewide child abuse and neglect hotline. And I'm just going to give you the numbers from March 2020. So for the week of March 2nd through the 6th, there were 4,800 calls to that child abuse hotline. You go another week later, it's 4,400. Another week later, it's 2,400. And then a week later, a week after that, it's holding at about 2,400. So half of the reports are coming in because people are not out in public right now. So we can make some pretty valid assumptions right now that there are less calls coming in not because there's less abuse, but because people are just not out in public as much. They're not being seen by other people right now, and so there isn't that same opportunity. So you know, if people want more data, I'm going to share my email address. It's repsinger@gmail.com. We can pull up more specific things. I love to talk about data on Friday nights. That's just that's my habit. So.
And I'll add this too, is that, I mean, you won't find a more quantitative animal than I am. But what I'd also say is that, I mean, data are great, no data are perfect, but if the numbers show they're going a little up or a little down, I'm not as interested in that as I am interested in the fact that those numbers represent people who are being harmed. And you can't convince me that a certain number is an okay number of it. So as some people continue to work toward minimizing and hopefully getting rid of someday. So even if the data comes out next year and it shows, oh, there was a little bit less domestic violence than before, there's still way too much of it happening. And that's what needs to change.
Yeah, thank you. Felipe has his hand raised.
Hello. Yeah. Hey, I'm sorry. Just trying to figure out the control panel there. Yeah, my name is Philippe Marquis. I'm a domestic violence offender. Yeah, thank you. I appreciate you guys hosting this call. This is really important information. Yeah, my name is Philippe Marquis, and I own a treatment agency in Lakewood, Colorado. We focus on the treatment of domestic violence offenders post-sentence, people who've been adjudicated for a domestic violence charge. And just to answer two of those things related to JB, one was that, and I think Callie, actually, you answered it quite well already, which is that in the state of Colorado, couples counseling is actually prohibited and contraindicated for individuals who've been convicted of domestic violence and sent to court-ordered treatment for that reason that Callie is talking about, that couples counseling suggests that the issue is an issue between the two individuals. And so that in that case, the locus of treatment is the couple and their dynamic. Whereas with domestic violence counseling, the locus of treatment is the abusive behaviors of the person engaged in violent behavior. And then pursuant to that also, I think JB had indicated something about why anger management programs aren't working. And anger management is a little bit different than domestic violence treatment, because with anger management, there is impulse control issues, and there may be some overlap and some additional elements of that. But in domestic violence treatment, the violence is viewed largely as a choice and as a mechanism of power and control over the victim, which is different than anger management, which is largely an issue of impulse control. So I just wanted to speak to both of those things. Thank you.
Thank you. Thank you so much. We have another.
You were the perfect person to answer that question. I apologize if I was too broad with JB's question. I think, you know, there are people in the community who seek services outside of the criminal justice system. And it's fair to say that me or Gordon and perhaps even Callie would not know about those successes or failures if people were not in the criminal justice system. So thank you for speaking directly to that experience and the rules and expectations around that process.
There's another question for Alexis and Gordon. What are there plans in place or maybe moving forward that to improve the system for domestic violence victims at the district attorney's office in each of your jurisdictions?
Yeah, I mean, I think it's a matter of priorities. You know, I think someone touched on earlier, maybe it was Callie or Alexis, that, you know, people push aside things like data because of resources, right? And it's true, we don't have the resources to do everything. And that will remain true, especially after COVID-19 and the hit we're taking. But so it's about where your resources go. And I don't think, at least in most jurisdictions in Colorado, that enough go towards domestic violence crimes. We've sort of talked about why those crimes are different and why they might need different treatment and more support for victims and so forth. And I don't know that we give them really their due course. So I would put more resources to that, to the attorneys and to the victim advocate side, if I was the district attorney here in Larimer.
Thank you.
So I think that there's certainly the prioritization of abuse when in an office, and that type of prosecution. It's making sure that people have the skills to handle those types of cases and to prosecute those types of cases. I think that in general, prosecutors could benefit from a bit of a culture shift around how they interact with survivors. there's a lot of kind of paternal instincts that go into how prosecutors approach these cases. And in that same way that we mentioned earlier about if you're the neighbor supporting a survivor and they don't leave, I think prosecutors know a lot of that theory or literature, but they don't necessarily do it in practice. And I think it's really important to allow for the victim's voice to lead prosecutions of domestic violence and sexual assault, especially for adults who are fully capable and older teens of articulating their needs and comfort level. We have the overarching need of keeping the rest of the community safe from offenders, but that obligation to the survivor for them to go on, it is proven that a survivor who feels as though their voice is heard is more likely to walk away and be able to heal. And that is also goes to our community safety when we have someone who feels like they can stand up again. So those kind of the overall is to obviously dedicate resources and have well-trained staff, but I think that there's also a kind of a different lens that we as prosecutors need to accept.
I also think too that when a victim feels heard and they feel like they not only are they being heard, but then justice is being served. Mm-hmm. I think that more victims will come forward because they feel heard and that something is being done on their behalf. I mean, do you not agree with that?
Yeah, I think you're right, Sally, and Alexis is right. It's interesting the point that Jonathan just made about, the number of reports does not reflect the number of instances, and that's true during COVID-19, but that was also true 6 weeks ago, right? The number of reports 6 weeks ago, whether it's child abuse or domestic violence, also didn't actually reflect the number of instances. So that making folks, shifting the culture, making folks feel comfortable, standing up, being heard, coming to law enforcement, going to their neighbor, what have you, is incredibly important and will be important well beyond COVID-19.
Yeah, and I want to reiterate that too. At the university and the Office of Equity, when we had people come forward with complaints about whatever it was, domestic violence, sexual assault, bullying, or whatever, the number one thing these people wanted was to be heard and for this behavior to stop. They were not interested in punishing. They were not interested in seeing people thrown off campus or even the criminal justice system being brought into it. Hearing people and validating them is so key. And unfortunately, in the history of our criminal justice system in general, that hasn't always been the case. And so we're seeing a sea change in the last many years, and it's very exciting with a lot of these great people running for DA that I think we're just gonna see us continue going in that direction. It's really needed. Thank you too for running.
Yeah, well, thank you all for being here tonight. I think this was really informative, and if there's any follow-up questions, please feel free to email us at info@sallyforcolorado.com, and we will definitely follow up with the panel for you and get you the answers and the resources that you're asking about.
I want to thank everybody for coming. This is great. Yeah, thank you for having us. Thank you, Sally.
Thanks.
And
You're
thanks
welcome.
Thank you, Sally.
This is an important topic, and it's important that we get it out there. I know a lot of people are asking about it. So thank you so much.
Thanks, Sally. Thanks, everyone, for coming.
Yes, thank you.
Thank you, Reverend.
Thank you. Have a great rest of your night.
Thanks for joining us.
Have a good one.
Thank you, Rep Singer.
Bye, everyone.
Bye-bye.
Bye.